work, Danny.
I'm here at Darren Weir Stables in Ballarat with Dr Andrew Cust, who most of you know has been the treating veterinarian for Dandino as part of his rehab program, Andrew, and we've just spent the last 20 minutes watching you scan the horse.
Yep.
And based on my calculations, I think he's been in here for about 10 weeks. I think he came in just early December, straight after our Christmas party. He's been on the treadmill since then.
Yep.
And today's just a routine scan to see how he's going. We've got some footage that we're going to show you shortly, but just tell us in your own words how he's going and what you saw this morning and what we can expect going forward.
Yep, thanks Darren. He's going really well. I'm very excited. As you said, he's been here for 10 weeks. He started off just walking on the treadmill for a few minutes a day. That was after the PRP was injected into his suspensory ligament. And basically this whole process up until now has been just training that tendon, the ligament, to really have a linear pattern vertically, so that when we start putting some pressure on his legs, that has the strength in the vertical plane rather than being a sort of a messy scar that has no regular strength. So far so good. He's sound at the trot. He's up to about 30 or 40 minutes of trotting and about 30 or 40 minutes of walking a day. So we're getting to the point where we're going to start doing a little bit of work over the next sort of 4 weeks. So this was a routine scan, and so far I'm very, very happy.
Tell us, use the words PRP just for the owners. Just describe what that is and what it actually tries to do.
Yep, so PRP is a product called platelet-rich plasma, and you'll hear in the football world and the netball world all these athletes getting these things called biologics, and this is a biologic. So this is where we take some blood from the horse and we spin it down, and so we can separate the liquid from the red blood cells, and then what we do is we filter out then the little tiny layer of platelets that are between the liquid and the blood. And within those platelets there's growth factors and complement and anti-inflammatories, and provides a regenerative action in the area that they're injected. And so then we take those and we test them to make sure there's a significant number of platelets within them. Then we activate the platelets so that they burst, and we inject that product back into the suspensory ligament or tendon or joint, and then we rehab the horse after that, hopefully using the regenerative powers of the PRP to provide as good a tendon or ligament in this case as we can get.
That ligament, look at it on the scan, it just looks like 1,000 rubber bands running down.
Yes.
And what we're trying to do here is restore the elasticity. Would that be a layman's description?
Exactly right. So a ligament and a tendon has thousands of small elastic bands called fibres, and when a horse injures a ligament, they break, and so instead of them being vertically aligned, they just become a mixed bunch, and then they scar up in that format and provide a weak elastic band. And so we're trying to realign the majority of the elastic bands to the best possible format we can to give it the most strength we can.
From what you see this morning at this point in time, I know you're very, very pleased with him, and I think he's a little bit better than what you might have thought. What can we hope for going forward?
Well, we hope for no setbacks, really. He's as good as I could possibly imagine at this stage. We don't expect an enormous amount at this stage. We expect the horse to be sound. We expect the leg to be nice and firm and no pain on palpation and no heat. And we expect even echogenicity on the ultrasound, and we have all those three. So that's an indication that we can move forward to the next part of his rehab program.
All right, well that's fantastic. So what is the next part of his rehab now? What do we do now?
Yep, so we step up the trotting even further now, and then depending on how he's going, in about 3 to 4 weeks we might introduce a little bit of canter work on the treadmill still, so it's a controlled, flat, firm surface, and then we'll be re-scanning him in about 8 weeks, barring any setbacks. All
right, well that sounds very exciting. So we'll come back and see you basically at the end of April, I guess, which will be the next routine scan.
Will be.
Hopefully we don't need to talk to you before that.
Hopefully.
Let's just have a look at some footage Shona took earlier on.
So here we are just about to scan Dandino's leg. Andrew, you've just applied some gel. This is Dr Andrew Cust from the Ballarat Vet Clinic. Hi Andrew.
Hi, how are you?
Good.
Good.
So just pop the gel on there, and what part of the leg will you be scanning today?
So we're going to be scanning the suspensory ligament. The old injury from around the spring carnival time was in the body of the suspensory ligament and extending down the medial branch of the suspensory ligament, which is just down there.
Yep.
So not on the surface, but deeper down between the tendons and the cannon bone.
Yep.
So first of all, we just have a look at everything, see what everything looks like, get a bit of an overview of how everything looks, and then we focus on specific areas.
Well, Andrew, it all looks encouraging and exciting. Thanks for your time this morning. Thanks for sharing your knowledge. It's really important that the owners get to understand exactly what we're doing and where we're at. And all I can say is I'm walking away here thinking we're on track, and we're probably just marginally better than where we thought we might be.
Yep, absolutely. No, I'm very excited, and it's been a major project for me, and I pushed hard with some of the owners to get Dandino to come to Ballarat with Weary so that I could look after him, and so far I'm very, very happy with the way it's going.
And we really do appreciate the time and effort Andrew has put in it, because he's not even going to charge us, he just loves the horse that much.
Yeah, absolutely.